Well, we've got to understand that we've got to focus on not only affordability but also accessibility of more healthcare in rural areas across Mississippi. This is an issue and a challenge in our state, but it's not unique to Mississippi. This is a challenge all across America, and most of us conservatives believe that Obamacare and the expansion of government-run healthcare is not a good idea. Most Democrats, on the other hand, believe that we ought to have a single-payer system. They believe in Medicare for all. And that's a major difference on a national level as to what approach we ought to be taking from a healthcare perspective. In Mississippi, we have announced our healthcare proposals, which we think will help improve affordability and accessibility, and also help our rural hospitals. First of all, you got to understand, we know that our rural hospitals are having challenges, and we've got to work with them to make sure that we have opportunities. Now, when we talk about healthcare, some of the things that we think that we need to do, and some of the things that we have done, that kind of we've started the process, but we have more work to do. One is we've increased the size of our medical school. We need more providers. We need more doctors. We need more nurse practitioners. We need more nurses. We need more healthcare providers in our state. It's the reason we invested $28 million in a new nursing school on the campus of the University of Southern Mississippi. It's the reason that we've invested $68 million on the campus of University Medical Center to create additional doctors. That has allowed us to increase the size of our medical school class from 100 docs up to 150 docs. But we need more of those 150 practicing in Mississippi and more specifically practicing in rural areas. It's the reason that I have proposed doubling the number of rural physician scholarships, because while we've spent $28 million in the last 8 years on that program, we need even more docs in the local area, in the rural areas of our state. So we propose doubling that. We also need more opportunities for residencies for our physicians across Mississippi. It's the reason that I have proposed more medical residencies in places not named Jackson, in places like Corinth and Tupelo and Greenville and Hattiesburg and the Gulf Coast. We need more, in Meridian, we need more medical residencies, and I am proposing that we invest as a state in creating those, and then ultimately in the long term they can be funded through other sources. We need more telemedicine in Mississippi, and Mississippi has been considered a leader in telemedicine. We need to do even more. We need to invest in telemedicine, because the reality is in rural areas across Mississippi we're not going to be able to have specialists, a heart surgeon and someone who focuses on strokes and other things in every single rural hospital around Mississippi. But what we can do is we can ensure every patient has access to those specialists, and the way in which to do that is through telemedicine. Because as I travel around Mississippi and I walk through ERs at various hospitals, what I see is telemed is there, and what they tell me is they can stabilize a patient that may be having heart issues or having stroke issues by talking to a specialist, and then get them to a facility that can treat their needs. And the other thing that we've proposed, which has worked in the state of Georgia, which I think will work here, is providing a tax credit for small businesses in local communities that want to invest in their hospital. Let's encourage and incentivize those who want to keep their local hospital to be able to do so by providing that tax credit, which will help the hospitals raise more money and encourage more people to participate in their local hospitals, and we'll do so through a tax credit. So it takes a little bit of money away from the state, but it puts a lot of money back in our rural hospitals. Well, the special session in 2018 was a good first step. The Mississippi Economic Council, I would argue, is the leading advocate for spending more money on roads and bridges, and they asked for about $300 million, between $300 and $350 million in additional monies per year. So what we passed will provide about $1.2 billion over 5 years, or somewhere between $225 and $250 million a year. So we didn't get all the way up to the number that they asked for, but we made a lot of progress. And I think that's the reason that the MEC called that plan not a single, not a double, not a triple, but they called it a home run. They called it a home run because they believe that the reality is that it's going to go a long way towards helping fix our issues. And in fact, the first $250 million has already been launched, and I am told that somewhere between 350 and 400 bridges are actually on the list to be fixed as we speak. They're going through the various environmental phases and the engineering phases, but between 350 and 400 bridges will be fixed over the next 12 months or so, and that's an awesome step to ensure that, particularly in our rural areas, that goods can get to market, because that's critically important. We need more work from an infrastructure standpoint. I think the next legislature and the next governor will spend time doing it. I do not believe that we ought to raise the gas tax to do it. That's a major difference between my opponent and me. He will raise the gas tax. He will sign legislation to raise the gas tax. In fact, he called it an easy solution. I will tell you that raising the gas tax may be an easy solution for a lawyer from Jackson, but it is not an easy solution for men and women who get up and put on their boots every day and drive 30 or 40 or 100 miles each way to work. I will not let them raise the gas tax, and I think that's something that's a major differentiating factor in this campaign. I think controlling spending is the enemy of, raising taxes is the enemy of controlling spending, and therefore, while I think that I think we receive a significant amount of revenue from a lot of different sources, and there's a lot of ways in which we could reduce taxes on hardworking Mississippians. I just fundamentally believe that individuals know better how to spend their money than any governmental entity ever will. Well, obviously we have to continue to be willing to invest more in public education. We're going to spend about $400 million more this year than we spent the year that I ran for lieutenant governor, so we're making progress there. But we've got more work to do. On teacher pay, we raised teacher pay in 2014, we raised it in 2015, we raised it in 2019. And those three raises, which cumulatively were about $4,000 per year, is in addition to the $500 raise that every teacher gets as they matriculate additional year in service. But the reality is we still don't pay our teachers what they're worth, and quite frankly, we'll probably never pay them what they're worth. But we have a teacher pay plan that I have looked at, the numbers, and I think one of the things that most people will agree on is that I am very focused on ensuring that we're fiscally responsible in the state. And so the teacher pay plan that I have proposed is one that we can afford. It also gets us to the Southeastern average within 4 years. It actually gets us to the SREB average within 2 years. It gets us to the Southeastern average within 4. That is an attainable goal that we can accomplish, and I have proven during my time as lieutenant governor that when I am committed to getting something done, I work very hard to get it done. What this is a 4-year plan which increases pay to the Southeastern average. It's $1,500 in year 1, it's $1,000 in year 2 and in year 3, and then an $800 raise in year 4. So it's totally $4,300 over a 4-year period. But it's not the only thing that I think we must do when it comes to teachers. I've also proposed to recruit new teachers to critical shortage areas. Critical shortage areas can be defined both in terms of geographic challenges as well as those areas like STEM, where it's harder and harder to recruit high quality teachers into those areas. We've got a lot of good ones out there, but we need to continue to recruit more. In addition to that, I have proposed that we take national board certified teachers. Mississippi has more MBCT teachers than any other state in the nation per capita. Currently, we provide a $6,000 per year supplement. That's a very good supplement, but I propose that we take that to $10,000 per year, because ultimately what that will do is it will ensure that Mississippi has the highest paid supplement for our national board certified teachers, and it has been proven through research and through data that those tend to be very high quality teachers, and so it's a way to reward more and more teachers to go through that program. And the other thing that I propose doing is that over the last 8 years we've doubled the amount of money going to teacher supply funds. I propose we double it again. So we've gone from $6 million to $12 million in the last 8 years. I propose we go from 12 to 24. I think we can do that very quickly, because I don't believe that teachers ought to be coming out of their pocket to ensure that there are supplies in the classroom. We can double that, we can do it quickly, and I think that'll go a long way towards minimizing, we may not eliminate it, but it'll go a long way towards minimizing the amount of out-of-pocket monies that our teachers have to spend on classroom supplies. I think teacher pay will help incentivize teachers to stay in Mississippi. It'll also help us recruit more teachers into the profession. We also believe that we need to continue to work with our institutions of higher learning to produce more teachers. We've got to provide innovation at the higher education level. The other thing that I'll do if I'm elected governor is I will create a teacher advisory council that meets directly with me. Doesn't just meet with staff, but meets directly with me as governor, so that I can hear from those in the classroom on a regular basis. I do it all the time now. I talk to teachers all the time in my current capacity. I travel around Mississippi. I just had a meeting down in Lamar County a few weeks ago. I'm going to have another one coming up really soon here in the central Mississippi area, in addition to other educators. But I think we need an official teacher advisory council that reports directly to the governor, and we can talk through some of these issues because I think more than anything else, many of our teachers, and my mother-in-law just retired from the profession after 34 years, just a year or so ago. They need to know that we are on their side, that we appreciate what they do, and we do. And by the way, they're doing great work. The outcomes in Mississippi are improving, and that's something we should be proud about. Well, one of my top priorities is going to be workforce development and workforce training. I have proposed in this campaign a $100 million investment. We have sufficient funds within our capital expense fund. We don't have to raise taxes. We don't have to increase the debt. We can take $100 million from our capital expense fund, immediately fund improvements to workforce training and workforce development. We can do so by investing in facilities, investing in equipment, investing in the professors and the teachers that are teaching workforce training. But career and technical education is going to be critically important for the next governor. I have a plan to deal with it, and that'll be one of the first things that I do.
Awesome. That's all I need.
All right.
Thank you.